Thank you, Dr. Barron, for those remarks, and also to Stephanie and the other conference planners for bringing us all together today. My name is Janet Welsh. I'm a research professor in the College of Health and Human Development and a longtime member of the Prevention Research Center here at Penn State. Prior to that, in my pre-academic life, I was a educator. I was a special education and preschool teacher. And my entire career in academia has been spent in very productive partnerships with the educational system. So it's my pleasure today to be the moderator for this panel, which involves educational systems, critical partnerships for evidence-based prevention. I have with me today 3 panelists. I have Dr. Paul Kazmarcik from the Carbondale Area School District, who has been a long-term partner with us on Prosper project. Ms. Melissa Tomascik, who is a technical assistance provider from the Penn State Extension System, who has the interesting role of having a foot in both worlds, both the academic world and the applied world, and Dr. Scott Gest, longtime friend and collaborator who is at the University of Virginia and has done a lot of research in educational systems. So I'm going to have each of them speak about themselves for a couple of minutes. Then I'm going to ask them some questions. And then if anyone in the group has questions that you've put into the Q&A, we can take some questions from the participants until the end of our panel. So with that said, I'm going to ask Melissa, why don't you go first? Introduce yourself and tell a little bit about what you do.
Great. Hello. Thank you for having me today. My name is Melissa Thomasic, and I am a technical assistant and a prevention specialist with Penn State Extension and the Penn State Prevention Research Center. My main role here at at Penn State is Prosper. See, I've always had Prosper on mind. And Prosper stands for Promoting School, Community, and University Partnerships to Enhance Resilience. It's a scientifically proven model for delivering high quality, universal evidence-based programs specifically targeted at substance use prevention. The Prosper model really is a strong working partnership between Penn State University, local Prosper community teams, university specialists, and researchers. And Prosper teams, they're located across communities across Pennsylvania. They really are the heart and soul of Prosper. These Prosper teams are led by Penn State Extension educators, and the team members consist of local stakeholders, school staff and administration, community agencies, volunteers, parents, and youth. So we really have a wide breadth of people that are really contributing to this initiative. And these Prosper teams, they plan, implement, recruit, sustain, evaluate evidence-based programs, these substance use prevention programs for their youth and families in their communities. And they're really changing the fabric of their communities. And I personally work with all levels of the Prosper partnership model. I provide technical assistance to Prosper teams, team leaders, and school districts. I coach prevention coordinators who are really the link between the university and these local teams. And I also work with the Prosper state team to strategically look at Prosper as a whole, how we can provide support, professional development, and sustain the model and programs with the highest quality. I'm also a certified trainer with 2 evidence-based programs, the Strengthening Families program for parents and youth 10 to 14, and the Social Emotional Learning Curriculum PAS. So thanks for having me today.
Thanks, Melissa. Dr. K, how about you?
Janet, thank you for including me in this fantastic opportunity to reach out and to continue to spread the word about the Prosper program, as well as the excellent evidence-based programs that we are able to deliver as a result of that. For far too long, Janet, for over 20 years, we've been in this struggle at times, but very rewarding experience that we've been able to offer to our school community here in the Upper Lackawanna Valley area. Melissa has worked closely with us in the past, and I know that we've tried to be very successful in our efforts. My involvement with the Prosper program and Penn State research efforts began over 20 years ago when we were approached to be one of the first school districts in Pennsylvania to pursue this model of presenting evidence-based prevention programs. And I can't emphasize enough how important it is to use the time that we have to interact with students and their families in a very successful way, rather than just throwing information out there in a one-time opportunity. The evidence-based programs, especially of strengthening families, I've been told by over 500 families that have been involved in the program that it provides them with a handbook, if you will, of how to deal with the issues associated with substance abuse issues that young people are facing. And I can't even tell you how that's been amplified over the past year with the pandemic and the fact that we've had to resort to virtual interactions with our staff, as well as virtual interactions with our families. Again, my background as an administrator, as both the high school principal and then the elementary school principal in the last 10 years of my career. And now I'm moving into my third elected term as a school board director in the school community of Carbondale area. And I will continue to support the Prosper model because it has proven results, which are track record proven results. And with that, I want to turn it back over to Janet, and thank you again, Janet, for this opportunity.
Thank you very much too, Dr. K. We're thrilled to have you with us. Scott, I'm going to ask you to introduce yourself a bit, and then we'll move into questions.
Great. Thanks, Janet. Good morning, everybody. As Janet noted, she and I have collaborated across many years and have been connected for a long time. I was at Penn State in the Department of Human Development and Family Studies for about 18 years until just a couple of years ago when we moved down here, and I'm chairing the Department of Human Services in the University of Virginia School of Education and Human Development. One of the interesting challenges in this position is that my department houses the programs in clinical and school psychology and school counseling and speech language pathology, and kind of underscored for me more than I had really even fully appreciated at Penn State, how distinct and separate many of these school-related professional tracks are, even at the stage of university training. So our students and faculty in these separate programs are largely responding to the needs of staying accredited within their professional lines and don't always have the opportunity to collaborate and interact with each other at the training level or in the practice level. One of the exciting new opportunities that's come up though for partnerships since I've been here is a new partnership called the Virginia Partnership for School Mental Health that was led by two of our faculty here, Julia Taylor in school counseling and Mike Lyons in school psychology, who worked with colleagues at the Virginia Department of Education to obtain 2 federal grants from the US Department of Education that support school mental health, evidence-based school mental health training for existing practitioners and for students who are in training in those different disciplines. So in the first year, what Julia and Mike have worked on is connecting with school mental health practitioners in regional school districts across a range of specializations, counselors, psychologists, social workers, nurses, to try to understand what their areas of concern are and where some of the gaps are in knowledge across these different specializations in how to support student mental health issues with evidence-based practices. So as a response to what they learned, they developed a set of online training modules, online learning modules that practitioners across these different fields can use to kind of begin to develop a shared vocabulary that bridges some of their professional differences and brings them some more contemporary information on evidence-based practices that have emerged in recent years. Importantly, one of the critical elements of the program is a set of monthly online sort of tele-echo sessions, which are staffed by a set of school mental health specialists who represent all the different mental health disciplines, and a set of about 30 practitioners who meet once a month talk a little bit about what's in the learning modules, but spend most of their time taking turns presenting case examples of challenging situations of practice and learning from each other as peers, but also from the school mental health specialists about how they might integrate evidence-based practices into their work. So the key is really, it's essentially like a continuous online learning community where practitioners overcome some of their isolation that they otherwise experience as oftentimes being the only counselor or the only psychologist in the school or in the district in some cases, and being able to really connect out across different school districts and universities. Over the next couple of years, the partnership will be expanding geographically to 2 other regions of Virginia where we'll be partnering with other universities who have training programs in these areas, along with their regional school districts, with the goal of really setting up a sort of robust, sustainable structure to support schools as they try to implement more evidence-based approaches. Across all of the elements of the participating universities, a key part of this is to connect school counselors and school psychologists in training with each other and with practitioners who are going through the program, so that they really from the beginning of their careers begin to see their own work in a broader context of multidisciplinary efforts at schools. So it's been a really great learning experience for me, and to be able to support and try to contribute to that kind of an effort. In some ways, I think of Prosper as our model in trying to have some sort of a sustainable, enduring structure where we connect practitioners to each other and to university resources.
Thank you, Scott. So we're going to move into our questions now. I'm going to pose the first question to the panel, and we'll have everybody take a stab at it. Dr. K, I'm going to ask you to go first, Melissa second, and Scott third, so we don't talk over each other. So our first question is, what do you see from your point of view as the benefits of researcher-educator collaboration?
Janet, I think one of the greatest benefits of this collaborative effort is the fact that with our audience, we are able to deliver in an efficient way the best possible programs to our families and taxpayer members, as well as students, that will provide them with the benefits that are necessary to combat the abuses of substance. It's been my experience that we have only a finite number of hours and minutes to interact with our students. And if we can possibly deliver to them and their families in an efficient way, a research-based program that has proof down in concrete terms as far as data is concerned of the success, then we are using our resources to the benefit of everyone involved. I'd like to think that both university researchers as well as school district personnel are in this combat together. And if we don't work together to get through this, it's certainly not going to be to anyone's benefit. In my 40 years plus that I've been involved in education, I've had the unfortunate opportunity to see far too many of my students be victimized by these substance abuses. And the least that we can do is to try to save the lives of one individual student at a time. And to me, that's the strength of the collaborative effort, the support, as Scott has mentioned, that the research universities and reaching out to educational institutions, working together, we can support each other in this battle. It all comes down to effort, time, and finally money. And unfortunately, the money part is something that we all must be faced with in education. And in my mind, if we can get the biggest bang for the dollar, then let's go for it. And let's look to research universities as well as research efforts to bring the best bang for the buck in the long run. Thank you.
Thank you. Melissa, you want to take a shot at that one?
Yes. So from my perspective, I think about land grant universities across the country, such as Penn State University, have wonderful connections into communities through the cooperative extension system. For example, Penn State University is connected to each of its 67 counties by housing a Penn State Extension office and workforce in those counties. And each and every day, Penn State Extension's mission is to bring education, services, programs, and research to serve the communities, including the substance use prevention through the Prosper Partnership Model. So as I stated earlier, the Prosper Partnership Model is a system to deliver the highest quality substance use prevention programs to youth and families. And we utilize a three-tiered communication model to connect the university staff and researchers to local communities throughout Pennsylvania. So through this three-tiered system, we're able to successfully implement, sustain, evaluate, and promote evidence-based programs in school districts across Pennsylvania, like Dr. Kazmarcik's at Carbondale and many others. So, and also universities are often looking for communities and school districts to try theory and these programs in the real world, where communities are provided with wonderful opportunities to the best programming and the latest research of what works. So for instance, in 2001, along with Dr. Kazmarcik, I worked with this ambitious Prosper project that started as a research project, and it was brought to a school and community, a school district that I work with in Luzerne County, who would have otherwise not have had this opportunity at all. So here we are in 2021, 20 years later, far beyond grant dollars, and Prosper and its evidence-based programs are going strong and growing. They really have become part of the community. It's a Prosper community. And we've graduated thousands of youth in our evidence-based in-school program and 981 families in the Strengthening Families program for parents and youth to 10 to 14. So from my perspective, these university, community, and school partnerships are the way to go for reaching our audience, having the maximum impact and outcomes that Dr. Kazmarcik, I'll echo that, the greatest cost effectiveness, sustainability, and communities have access to the latest information and research. So from my perspective, it's the way to go, for sure.
All right, thanks, Melissa. Scott, what are your thoughts from the researcher perspective?
Sure. Well, my vantage point is really different in the sense that what resonated for me is a couple of years ago, some colleagues at the William T. Grant Foundation, which funds a lot of research on youth development, wrote an article about the importance of bringing rigor and relevance to youth research. And what they meant by that was it's important to do research that's high quality, that meets good high scientific standards, but also that is relevant to practice, to areas of practice. And I think it's that latter part that's really difficult for researchers often to stay in close touch with, because it takes a long time for us to develop our ideas, to get our research funded, to kind of think about the most rigorous recent ways of doing research. And along the way, it's easy to get disconnected from what are the real concerns of practice, which evolve in some cases very rapidly, and are concerned with more practical issues of how services and schools and professions are set up. So to me, the advantage as a researcher and having a sustained partnership with practitioners is sort of staying tethered to what's relevant and really thinking hard about what is it that we know that can be brought out into a useful format for practitioners. So from my standpoint, having those kind of sustained relationships that help us keep our focus on questions that are relevant is the key.
Okay, thanks, Scott. All right, next question. So it's kind of the flip side of the first question, and that is, what are some of the challenges of implementing evidence-based prevention in educational settings? And what are some of the possible solutions to these challenges? This is sort of a two-part question. Dr. K, you want to give it a go?
Janet, I'd like to start with piggybacking on what Scott has mentioned about the importance of rigor and relevance. From my perspective, rigor and relevance also is amplified in the administration of evidence-based programs by the issues of validity and reliability in the delivery of the programs. And that's a constant issue, but we look to the university and the Penn State Extension experts to provide us with the feedback that we need through observations to guarantee that the rigor and relevance of the programs, as well as their validity and their reliability, are being delivered in a prescribed way. So that is a constant challenge. But again, working together in a collaborative effort, we can surmount that one obstacle. The other obstacle is always selling the program. I've been told, because of the virtual nature of our interactions during the past year, that it's been an uphill battle in getting parents to become involved in the programs of the Prosper model that are evidence-based. But again, it's word of mouth in our community, where we look to our families who have gone through the programs and can speak to the success of the programs in concrete terms. We look to them to kind of be the mouthpieces of spreading the word and getting the word out about the relevance of the programs and the fact that they can really help with the day-to-day issues associated with raising families in today's tumultuous world. And finally, the last challenge is always the money. And my thought there about the money is, let's spend the money to prevent something rather than waste the money on trying to heal the problems associated with the problem. So it's either we'll pay up front and see the benefit, or we'll pay down the line. And that is, again, something that we constantly grapple with in the public sector. But we look for resources, and we look for resourceful people to kind of bridge the money issues. We've been very fortunate in our community that the Prosper program has undertaken numerous fundraising efforts that have received community support. So again, these issues of selling the program, speaking to validity and reliability, and looking to the efforts of time and money are just some of the challenges in implementing any program. But again, I look at these as all opportunities to become successful and to impact the lives of kids and their families. Thank you.
Thank you very much, Dr. K. Melissa, anything to add to that one?
Yes, definitely. So from my experience being like a technical assistance provider and assisting school districts with evidence-based programs, there's several things that keep coming up, several challenges, that we see wherever we are, how great we are doing, how successful we've been, how challenging it's been. So program selection, sustainability, staff turnover, sometimes competing programs and initiative and funding. When we think about program selection, providing school districts with the resources and the expertise to help guide, direct, and indicate the most compatible and impactful program for their needs. University researchers and staff, are really good at analyzing programs, and we should utilize that expertise that they have. So what does the data say for a programming, and what kind of study was it? For instance, is it a randomized control trial? Or is it pre and post surveys, or is it just word of mouth feedback for a program? And it's by no fault. Sometimes school districts choosing a new program, they don't understand or know the difference, the greatest difference of that. So we want to be able to provide school districts with that expertise and how we could help them choose the best programs to have the greatest impact for your buck, as Dr. K had said. Staff turnover. Staff turnover is inevitable anywhere. So to devise a plan in advance is really, really important, and to see changes coming. One school district that I work with in Luzerne County, they recognize the impact, the need and the outcomes for a particular program that we utilize called Botman Life Skills Training. And they've actually put that curriculum in the health teacher the job description. So that way they know that that implementation, it's expected and it will be insured for whomever goes into that job. So that's one thing that we've, really been so happy about those changes. For competing programs and initiatives, I know sometimes you're chasing the money to get the programming out there, but we really want to take an inventory of what our school district and community, what they're doing, seeing what's out there, what kind of evidence it provides and how it's funded. So could these initiatives and organizations, can they collaborate? Can we replace evidence-based programs with non-evidence-based programs? And is this project a real need in the community? So we want to make sure that we keep our pulse on the data, the statistics, the evidence. And then also, thinking about funding, exactly what Dr. K says, it all, a lot of times it just comes down to being able to have the money to be able to do this. And it's really important, we get so caught up sometimes in programming and getting everything done that we have to keep our finger on the pulse and networking with local stakeholders and community organizations, including healthcare systems, the criminal justice system, faith-based organizations, because these systems, they're so resourceful and they can provide a wealth of information and opportunities for funding out there. And it's really about networking. I say with my job, and I'll say it again, it's all about relationships, building those relationships, fostering really good relationships, because once you are really close with community organizations where you're doing programming, it's so much easier. People want to connect. They want to be part of something. They just need to know about it. All right, thank you.
Great, thanks, Melissa. So Scott, what are your thoughts about the challenges involved in these types of partnerships?
Yeah, so I feel like Dr. K and Melissa really hit on many things. I'd like to say I was smart enough to have all those on my list, but I'll let them sort of speak to those. Our partnership has kind of raised my awareness of a different kind of challenge, which is, our partnership is less focused on implementing particular curricula within schools, classroom curricula, say, or services through a school, but more around evidence-based practices, sort of best practices, ways of managing student mental health issues. And those issues in particular tend to hit at the intersection of several different professional roles within the school. And it really raises attention to the different types of training that different school professionals receive. Counselors, psychologists, social workers, nurses, teachers, they all have to collaborate together with each other around mental health issues, but they often are coming from very different quantities and historical traditions of how those approaches, how they're trained in those to deal with those issues. And so what's really jumped out at me in watching how our partnership has taken shape over this last year and a half is that a good bit of the front end effort has been on establishing that everyone's role is valued and everyone's, no one should feel threatened or undermined by advances or changes in how other related roles are taking place. And I think it's an understandable concern whenever you try to add something in one part of a school that's an interdependent, multidisciplinary service team, it can cause disruptions to other people's roles. And I think figuring out ways to develop a shared vocabulary and to think about when you're making when a program is going to be delivered through one professional role, how does that impact adjacent professional roles? How do other people, if there's a classroom curriculum being implemented that deals with mental health or substance use, how might that show up on the radar of the school counselor or school psychologist? Or if there's going to be a new counseling program or mental health program through the specialists, how might that manifest in the classroom, and how might teachers be made aware of that so that they can support and not inadvertently kind of work at cross purposes? So to me, I think it's those issues of the complex service systems that schools represent and how to think beyond just the narrow delivery of programs to how other sort of adjacent professions can experience it and hopefully be brought in to support it, as opposed to feeling like it's just another thing that someone else is doing.
Okay, thank you very much, Scott. So the next question I had dovetails with one that was put into the Q&A, which is that how do you keep this going? So what are the sustainability challenges? I had said, let's speak to sustainability as one of my questions. And then one of our attendees also said, you know, one of the most impressive things about Prosper is its longevity. So I wondered if any of you, or all of you, I guess, could speak to that issue of sustainability, because I think we've identified this as a challenge in many things involving dissemination of evidence-based practices into real world educational settings. So Dr. K, we've sustained you for a long time. We've sustained our partnership. What are your thoughts about that?
Well, first of all, I think my role as board member is a key factor in sustaining Prosper. In my interactions with other board members, new staff, as well as the relationship that I have continued to sustain, I think it's part of my responsibility as a board member to keep selling the program to the key stakeholders. We have success, and in order to continue that success, we must continue to be committed to the program. So that's number one, getting stakeholders informed and keeping them informed. I also think that part of the role that Penn State Extension has taken on in each of the interactions within the school districts that are modeling the Prosper program is the fact that we've entered into a collaboration between school districts. I know in the neighboring Wayne County area, in light of the virtual situation that they're dealing with, they've provided the opportunities for parents to move between school districts to engage in the programs that are ongoing, which in this day and age, the more flexibility we can give parents and families to be engaged, I think will be to our benefit. So that certainly is a way to move towards sustainability. And finally, I really do think that the Prosper program, if it'll allow me to, has become institutionalized within the northeastern region of Lackawanna County, Luzerne County, and Wayne County. And as a result of that, parents are one of the ways that we can continue to sustain the program through the word of mouth that they have. I also do think, in light of the particular issues related to mental health that are inevitable to surface as a result of this one-year crisis that we've lived through, we have to continue to be on our toes to provide parents with good research-based programs that address the needs that they face in raising families, in dealing with issues not only of substance abuse, but of mental health. And if I can repeat the points that Melissa has made, it all comes down to data, networking, and reaching out to stakeholders, which again are key components in my mind about sustaining a program, showing people that the programs are working and that we have hardcore data based on science. And we all know that there are many naysayers out there these days who are poking holes at science and what science can deliver. But this is evidence-based programs that is based on good science and good data. And with all that being said, it's still going to be an uphill battle. And anybody who thinks that the battle is going to be over when we get to the top of this next hill is sadly mistaken, because there is going to be another battle that we're going to have to face. But we're willing to do it, and we can do it with facts, data, and science to back up the decisions that we make.
Thanks, Dr. K. Melissa, any thoughts about sustainability?
Yes, I love the quote, teamwork makes a dream work. And I truly associate teamwork with sustainability. So these community prevention coalitions such as Prosper, or even CTC, Communities That Care, with a paid team leader and mobilizer and buy-in from community organizations, who are willing to show support, commitment by providing staff with the time devoted to the initiative or project. Because when we have a community with similar vision and mission coming together, working towards something, we're so much more likely to have success. You know, often, you know, if there's one person leading an initiative in a program, it leads to burnout, you know, and then the program might just be over. But when we have a group of people working together and really wanting to get something done in the community, you're that much more likely to be able to not only get it done, but sustain it and do it well. So, you know, when we think about these prevention coalitions, you know, towards an initiative or program, it's so important to build and foster relationships. It's not immediate, it's slow and steady. And as I said, you know, to do that with school, district staff and administration, organizations, businesses, and individuals with that similar vision and mission of youth and family resiliency and substance use prevention. We have to find champions in our community, and we have them out there. We just have to look for them. And then also, you know, when we're implementing programming, you make sure you collect data and outcomes to provide evidence, because that will only help promote and sustain your efforts within your community. And I can't say it enough, is to show appreciation for those that you work with. You need to recognize, you need to share and promote the successes of the programs, the coalition, the community organizations, the individuals and participants involved. You have to celebrate together. So I want to congratulate Dr. K, who I've worked with for so long, and what you've been able to do and your support in Carbondale, because we wouldn't have been able to get where we've gone without people like you. So I really appreciate that. And yeah, thank you very much.
Great, thanks, Melissa. Scott, any thoughts about sustainability?
Yeah, it's interesting, having come here from the land of Prosper, where I have heard the great advantages of the, you know, extension infrastructure as kind of the sort of base from which all of these more specific practices could emerge, you know, that Melissa has talked about. We don't have that, at least through UVA. Virginia Tech is the land-grant institution in Virginia. And so, you know, we had to sort of think about other structures to sustain the kind of partnership that we're building now. And really for us, the critical linchpin is the state engagement, right? So the federal grants are actually obtained through the state, although much like the epicenter at Penn State, the state then designates UVA as sort of the hub of providing the technical support and consultation to partners around the state. And, you know, the challenge is thinking about, okay, when those grants are done, you know, the state can sustain, has an Office of Student Services where we have strong disciplinary connections with our faculty and who are very supportive of this effort. We will have developed, I think, probably to a larger degree than Prosper did initially because of the era when we're starting, a lot of online learning resources and support structures like the monthly sort of tele-echo support communities. I think what we have to figure out how to do is how to build in the personal face-to-face relationships. The idea is that the regional universities that are engaging with regional districts will be a base for that. But there are parts of the state, as in Pennsylvania, that don't have a really nearby hub of a university training center. So how we kind of reach out and eventually sustain relationships across those kinds of distances is going to be tricky. I think the web-based learning communities could play a really critical role. The feedback certainly has been really positive from practitioners who feel very connected to each other across a few of these sessions because they're hearing directly from each other talk about challenges they face at their schools. And that seems to be very meaningful. So we're hoping those kinds of structures will lead to the partnership being sustainable, even though we won't have the infrastructure of the extension system to kind of provide some kind of a stable base for that.
I appreciate you saying that, Scott, because you're right. Not everybody has this great network of extension busy bees like we have here, right? I mean, they're everywhere. And that's been super helpful for getting Prosper out there. We have a couple of minutes. I pulled several questions out of the Q&A, and this one is very related to some of the things we've been talking about, which is how can siloed systems leverage different funding streams to maximize their effects? And Scott, this seems very aligned with what you've been dealing with. So I'm going to have you take this one first.
Yeah, I mean, so I guess you could say in our case, the siloed systems were, for example, the school counseling and school psychology graduate programs that are in my department. Faculty connect with each other, see each other in the hallway, but the students, I think, essentially don't interact with each other at all prior to this. So as part of this initial round of this partnership, we created a couple of 1-credit courses that we called like leadership in school mental health, that students from both programs take so that they connect with each other and are actually team taught basically by school counselor and school psychologists. That kind of creates a little bit, hopefully at the training stage, of some cross connection across those disciplines. That doesn't require a lot of funding. It just required a little bit of flexibility in how the curriculum worked without adding too much to either program's plates. And we've similarly tried to use the funding from the federal grant to kind of facilitate these multidisciplinary online learning communities. But the idea that we're starting to look at as different, as the partnership has become more visible in the state and other potential partners around allied issues, not necessarily directly focused on mental health, but other youth development and resilience kinds of focused community efforts. We're trying to be flexible and kind of modular in our thinking about, well, could we create additional learning modules, for example, on professionals that deal with how to intersect with community resources, or to engage in some projects that would map community resources to, for youth, to regions that that are participating in the partnership. So we're trying to build the possibility of certainly accepting other sources of funding and respecting what they would want to integrate into this bigger picture. But right now, it's not easy. Sometimes the grants themselves have a provision that requires interprofessional training. And to some degree, each of the professions within its own guild is now sort of at least giving lip service to the importance of interprofessional training. So we're sort of looking for opportunities and funds that would support creating more of those connections, both at the training level within the graduate programs and then out in practice through, tapping different funding sources to engage more different types of practitioners.
Great, thanks, Scott. So Melissa, as someone who's led Prosper teams and brought diverse stakeholders together and shepherded them along, what are your thoughts about the siloing issue?
Well, that is one thing that I must commend Prosper teams, is they are so resourceful, and having the 3-tiered system of trying to find funding for sustainability has been fantastic, because we have, the state team who is looking at all different opportunities for grants to help sustain Prosper. And then we go to the local teams who are really, we have such a large portfolio of, whether it be like different foundations or looking at very creatively, who wouldn't typically support programming, that we're really, educating them about how prevention, can affect not only, these school districts and youth and community, but the whole community as a whole. So, we've gotten so creative. We have, we've gotten foundations, we've gotten, definitely gifts of money, but we've, as Prosper teams, we've had yard sales, we've had car washes, we've had, all sorts of things that not only, raise a few $100s, but really keep the teams connected. And, we say we might only make a little bit, but the way that it has for team morale and keeping the efforts of sustainability of like the team working together does wonders. So we have a large portfolio from all over the place.
It's as important as the money, right?
Yes.
Is the getting people to work together. So Dr. K, we have 1 minute left. Any thoughts about siloing from all your years in the education field?
Well, Janet, I think you are the queen of Prosper, but Lackawanna County has had in the past an extension expert working with us, Karen Thomas, who's given unselfishly of her efforts to build that team perspective. And every team meeting, you need to know when Karen was in charge, the last thing we always spoke about was sustainability and how we were going to make the impact of what we were doing continue beyond our own team membership to the long term. And again, I think that speaks to issues of siloing, if you will, but more importantly, it proves to me that as long as you're being flexible, as Scott has mentioned, and more or less Melissa has said, we have a responsibility to continue to think outside the box. With all of that being said, I think that we can continue to deliver sound evidence-based programs to our populations.
Thank you very much, Dr. Kay. And with that, we're going to wrap up our panel. At this point, we're going to take a 5-minute break and we'll come back at 11:20 for the next panel, which is engaging in faith-based communities, an opportunity and a challenge. So we'll see you all very shortly. And I want to thank my panelists very much for your time today. All right, everybody. See you shortly.